Hi, it's nice to meet you. My name is Claire, and what's your name?
Hi, I'm Alice Green.
Okay, well, it's nice to meet you.
Nice to meet you too.
Now, real quick, how do you spell that? Is it Alisce or?
Yes, that's correct.
Okay, and then is it Green with an E at the end or no?
No E.
Okay. Okay, so before we begin, I just wanted to go over a few things so that way you understand with this session today. Is that all right?
Yeah.
Okay, so for today, I wanted to clarify your rights and limitations. So you do have the right to confidentiality. However, if you reveal any information where you have harmed yourself or others, I am required to report that. Is that okay? Or
yes, I understand.
Okay. And then another thing too is that by the end of this session today, your health insurance will be billed. So therefore, what that means is by the end of this session, you will be receiving a clinical diagnosis before you leave. Like, that's not what I like to do, but that's part of our policy. Does that make sense?
Yeah, that makes sense. It is what it is.
That's very true. That's very true. Although, like, I wasn't trained specifically for this, but like you said, it is what it is. Okay, so Alice, could I please get your address?
I live on Golden Gate Drive.
Okay.
The house number is 178. And I live in here in San Francisco, California.
Okay, San Francisco. And then could I get your phone number, please? Either a home phone or cell number.
Yes, it's a 518.
Okay.
707.
Okay.
0092.
Alrighty, and then do you have a phone number for your work?
I'm currently unemployed. Well, I'm taking a break from work right now. I'm a guidance counselor.
Okay.
But the phone number is 564.
Okay.
782.
Alrighty.
9042.
Alrighty. And then could I get your date of birth, please?
It is July 25th.
Okay.
1988.
Okay, then your social security number?
401.
Okay.
22.
Okay.
4452.
Okay, and then do you have children currently, or?
Yes, I have 2 kids.
Okay. Are they both boys, girls, or one of each?
I have 2 girls.
Okay.
Their names are Jess and Casey Green.
Okay. And then who's the oldest out of both of them?
Jess is the oldest.
Okay.
And she is 14. I had to think for a minute. Once they get into teenage years, it all flies by.
Oh, that's very true. A few previous clients have acknowledged that. And then how old is Casey?
She's 8.
Okay. And then what is your marital status?
I am currently married. His name is Michael Green.
Okay. Alrighty, and then you said that you were a guidance counselor. So are you a guidance counselor at social services, or?
I'm a guidance counselor at Golden Gate Elementary School.
Okay. Okay, that's a very noble job to have.
Yes, it's hard work.
It's hard work, but would you say that it's rewarding?
Yeah, it is.
That's good. I like hearing that.
Yeah, I like working with kiddos.
That's very good, because a lot of people can't do that.
It takes takes a certain person, I guess.
That's very true. That's very true. So I have to put in an information for emergency contact. So who would you like to put as your emergency contact?
I'll put my husband.
Okay. And then your husband.
Do you need his birthday?
No, but just a reliable phone number.
Okay.
If you could.
It's 270.
Okay.
510.
Okay.
0492.
Alrighty. Okay, and then these next set of questions would have to deal with your health insurance. So who is your primary medical practitioner?
Humana is my health insurance. My primary physician right now is Dr. Jones.
Okay, and then what's a good phone number to reach Dr. Jones?
270.
Okay.
234.
Okay.
3942.
Okay. Alrighty, and then are you currently seeing any other specialists, such as like a clinical mental health counselor, physical therapist, anything of the sort?
Not currently, no.
Okay, put on applicable for. Okay. Alrighty, so before meeting you, I heard about your referral from the medical center, and that's why you're here to see me today. Is that correct?
Mm-hmm.
Okay, would you like to clarify what was stated in the referral, or like why it is that you were currently at the medical center?
I've been struggling with alcohol. I have a very negative relationship with alcohol. I've been abusing it for a while. But the incident that brought me to the hospital was I was really, really drunk. I drank a quart of vodka that night. I ended up hitting my daughter.
Okay.
And I faintly remember getting in the shower, and I turned on the shower, and I lost my balance. I was like stumbling, and then all of a sudden I am on the floor, and there's glass all over the floor, and I have glass in me, on my arms, legs, and there's blood everywhere on the floor. And excuse me, it's hard for me to recall this because I was,
Yeah, that's okay.
But I was rushed to the hospital.
Okay.
And I got lots of stitches.
Alrighty, and then you say that there was broken glass. Where did that come from?
The shower door. Excuse me, I didn't specify.
No, that's fine. There's some tissues right there if you'd like to help yourselves to some. You're welcome. And so you mentioned that you had drank a quart of vodka. Was it just this particular day, or would you say it's like a normal behavior?
That's been going on for about close to a month. I've been drinking a quart of vodka a night.
Okay. And then, have you noticed anything else? Any other type of attitudes, behaviors, or symptoms as drinking a quart of vodka occurs, or?
I sleep a lot. Sometimes my alarm goes off for work and I would miss work. I've become really, really aggressive towards my kids. And, before the alcohol abuse, I didn't lash out as much, and I feel like I'm a bad mother. And I'm trying to think if there's anything else that I've noticed. I have really severe anxiety after I wake up drunk and hungover, and but that's partly because of the substance abuse.
Okay, and how would you describe your current relationship with your children?
Strained right now.
Okay.
They think I need help.
And would you say both of them have said that, or is it just one daughter or the other? Or?
The oldest, particularly, the 8-year-old, she doesn't really quite she knows that whenever mommy drinks, it changes my behavior, but she doesn't quite grasp the severity of what's going on, as opposed to the teenager.
Okay. So you would say, like, in a way, your oldest is trying to be strong, not just for her, but also for the youngest.
Yes.
Okay.
Yeah, she's almost kind of had to take a caretaker role, especially whenever I sleep too much and I'm not as attentive as a parent.
Okay. Well, how would you describe both of your daughter's relationship with your husband?
I'd say it's good. He's a good dad to them.
Okay. And what does your husband do as a career?
He's a pilot.
Oh, okay. Take it he gets to travel to a lot of places.
He does. He goes on a lot of business trips. I recently forgot about one while I was drunk, and I ended up feeling really guilty about that. So forget. And how would you describe your relationship with your husband? Difficult right now. He has mixed feelings about me seeking treatment. He thinks AA is dumb and doesn't help, and he's recalled a couple times that he likes it whenever I drink.
Okay. So why does your husband believe that AA is dumb?
I'm not really sure. It could be maybe because it's Christian based. I'm not really sure what his opinions are. He's kind of the type that thinks that you should solve all your problems on your own without any outside help, and I guess he might be against like me making friends with other past users, even though I see it as I can form relationships and they can help me through this recovery process.
Would you say that your husband is religious or no?
No.
Okay. Would you say that like you befriending people who are in recovery as well? Would you say that he feels threatened by that, or?
I don't think so necessarily. I don't think he would be threatened. I don't know. I think maybe he just maybe wants to keep our problems within the family.
Okay. Now, you had mentioned earlier that you feel that your husband thinks that he likes you better when you drink. So what exactly do you mean by that?
I think in a way he likes saving me from my situations. It makes him feel powerful. I at our vacation in Mexico, I got super wasted on on a sailboat and fell into the water, and he had to dive in and save me, and I was basically drowning, and I couldn't swim. But I don't know, it could just be my personal opinion or observation, but I think he likes basically like the thrill of like saving me, and it makes him feel more masculine. I don't know.
Yeah, or I shouldn't say that because I've never experienced that, but however, I'm doing my best to understand what you're saying.
Yeah.
Okay. Alrighty. And then, are there any other type of symptoms that you feel that you have experienced within the last month? So far, I've got drink a quart of vodka every night, sleep a lot, and with sleeping a lot, that would inquire, like sometimes you forget to go to work after your alarm goes off and you sleep for most of the day. And then you've noticed like aggressive behavior towards your children, and you've acknowledged that your relationship right now is currently strange, and your oldest Casey is in a situation where she's trying to be strong both for herself and her younger sister. And then you've also mentioned that that your husband has a good relationship with both of your children. And then you've also mentioned a symptom that includes like forgetting important dates. And that also, and with important dates, you gave the example of you forgot your husband's business trip. Mm-hmm. Is there anything else, or?
You summarized that really well.
Okay.
Of kind of what's going on. You know, I'm just hoping I can find some help.
Well, that's what we're here for.
Mm-hmm.
Okay, so you're welcome. And okay, so we're gonna go over a mental status. So do you have anything related to any types of obsessions?
Besides alcohol.
Well, is there any?
Well, is there obsession? No.
Okay.
Sorry, that was a bad joke.
No, it's okay. That's okay. Sometimes we got to be able to laugh stuff off, right? Yeah. Okay, so no obsessions. How would you describe your mood right now? So normal, euphemic, depressed, irritable, angry, euphoric.
I don't know. I guess as of right now, I am a little depressed, but I just feel embarrassed about all the situations that I've gotten myself in with alcohol. Mm-hmm. But I'm still able to remain hopeful.
Okay.
So, I guess my mood's pretty stable right now.
Okay. So, with the thought of content, do you like to fill that in saying that you're hopeful?
Mm-hmm.
Okay. Have you shown any signs of delusions or hallucinations?
No.
Okay. Okay. This next question, you can answer it in terms of now or from your a time when you drink. What would you say how would you describe your thought process? Like, would you describe it as logical, coherent, goal-directed, flight of ideas, preservation blocking, looseness of associations, disorganized, things like that?
I guess it'd be like, whenever I'm drunk, I have a looseness of associations.
Okay. Alrighty, and then, okay, how would you describe your speech right now? Would you say normal, slurred, slow, or?
I'd say normal.
Okay. What about your motor skills?
They're slowed.
Okay. What about your intellect?
I feel like it's not as sharp anymore.
Okay. So would you?
I mean, I don't have any intellectual disabilities or anything like that. But are you talking about presently?
Yeah. So it can range from average, above, or below.
I'd say it's average right now. Just whenever I drink, it's a little dulled.
Okay. So how would you describe your insight? Would you say like it's impaired or partially present or present?
Present.
Okay. And then would you describe your judgment as intact or impaired?
It's intact right now that I'm sober.
Okay.
I guess it would be different if I showed up to this session drunk.
Probably. Maybe. Possibly. How would you describe your control of impulse?
It's difficult because I lash out at my kids. What are the options?
Adequate or impaired?
I'd say impaired.
Okay. And then what about your memory?
Fairly impaired right now. It's hard because whenever I'm drunk and people tell me things, I forget, and whenever I'm sober, I can't remember.
Okay, so I'll put recent, and then how would you describe your level of concentration right now? Would you describe it as intact or impaired?
It's intact right now.
Okay. And what about your attention span?
It's fine. Yeah.
Okay. And then, how would you describe your behavior? Would you describe it as appropriate or inappropriate?
In this session, it's appropriate. Yeah.
Okay. Okay, and then is there anything additional you would like to add in regards to your thought process? It could be like currently or any past experiences that led you to be here today.
I guess some negative thoughts that are affecting my emotions and feelings are, I just keep on replaying these scenarios in my head. And then that results in me feeling guilty and shame. And yeah, I just feel really embarrassed for how I've acted, and I've put myself. Pretty much I could have died in Mexico, and I could have died, with me in the shower accident, or bled on the floor. So I guess just me kind of just looking back on all that, but I'm willing to put that behind me and move forward.
Would you say that you have a want and desire to go forward as well?
Yes.
Alrighty, and then now for this assessment as well, we are required to do a risk assessment. So basically, I'm asking, do you ever feel any thoughts of or have any thoughts of suicide at all, or?
No.
Okay. And then any thoughts of like homicide or anything?
Mm-mm. No.
Do you have any allergies to any types of food or medications?
Not that I know of.
Okay.
I get seasonal allergies sometimes, I guess.
Okay, that's fine. I'll make that note. I'll make that note anyway. And then, are you currently prescribed any medications?
No.
Okay. Are you currently taking any type of medication?
No.
Okay. And mind you, when I also actually let me reiterate that question. It can be prescribed or over the counter medication. So is your answer still applicable?
I mean, I take aspirin sometimes.
Okay.
I took it one time whenever I was drunk, and I didn't think it would affect me, but it did. It just caused me to black out.
Alrighty. So basically, you mixed aspirin with vodka, and it caused a blackout.
Yes.
Okay. Have you, prior to this past month, have you had any previous experiences with chemical dependency that could include like substance abuse?
I mean, besides alcohol?
Correct.
No, nothing besides alcohol.
Okay, and then no. Have you had any previous psychiatric hospitalizations? So,
not psychiatric. I went to the hospital to be treated for, me falling in the shower, but no psychiatric visits.
okay. And then have you had any prior outpatient therapy? So this could include like any previous experiences of attending rehabilitation centers or meeting with an interventionist?
No, this is my first time.
Okay. And then, is there any previous family history with chemical dependency? This could be both substance abuse and alcohol.
My dad he uses alcohol, and ever since I was a kid, he has drank, and that actually, I guess, exposed me at a young age. I started drinking, or I had my first sip of alcohol around 9, and then I really started getting into drinking in my teenage years.
Okay.
And yeah, this problem has occurred for a while because I'm 32.
So would you say that like during like that first time of being exposed to alcohol at age 9, was it just something where alcohol kind of like helped you build a comfort of some type, whether it was drinking it or just even like looking at it?
I don't know if it was. Whenever I was 9, it wasn't more of a comfort. It was more of like a curiosity. But whenever I was, a teenager, I more did it as a way to self-medicate.
Okay.
And to have fun at parties or whatever.
Okay. So now these next questions, they relate to the psychosocial information for each client. So for you specifically, would you say that there are specific support systems that you currently have, or maybe you would like to have?
I consider my husband a support system. And then my parents, my mom specifically, and my daughters, even though I'm supposed to be the caregiver and the supportive one, like they also are supportive towards me and they love me.
Mm-hmm.
I'm hoping to find a support system with AA meetings and with you.
Okay.
If I see you in the future.
Okay. Now, from what you have previously described to me, more specifically with your husband, like when you earlier you had mentioned how you feel like he has to always rescue you and all of that, and you also stated earlier that he acts like he likes you better after you have drank. Is that correct?
Mm-hmm.
Would you say that currently right now that's a positive support system or a negative support system?
I would say for my treatment, a successful treatment for me, it would be a negative support system, but I still love him and I care for him. And I mean, he's my husband. I love him for better or for worse.
Mm-hmm.
But I guess I could maybe consider more finding my own independency through this process.
Okay. And then would you say that also, like, for your own independency, would you also think that your husband would need to find some independency as well?
Yes, I guess our relationship can be described as very codependent on each other.
Okay. Yeah, that's something that I see with previous clients as well. So
maybe you could refer me to a couples therapist.
Absolutely, I will make that note for you, and I will give you. I'll provide you some information by the end of this session.
Thank you.
You're welcome. How would you describe, like, I know you previously stated that you are currently unemployed, but how would you describe, but before you were unemployed, how would you describe your work life?
Good. Admittedly, like working in the helping profession and being a counselor, it's a hard job. I hear so many students go through such hard home lives, and being able to disconnect myself with their problems and my own problems. Like I was using alcohol as a method to self-medicate my feelings of personal work stress.
Mm-hmm.
And I'm now seeing it as, in order for me to recover, like I can't do that anymore. I can't, every time I'm stressed, I can't turn to alcohol.
Mm-hmm. So from what you would describe with your work life, you would say that you'd find your work life rewarding, as well as like a way to turn off any personal problems that you currently experience.
Mm-hmm.
Okay. Now for this next for this next section, there's just some questions regarding some history with substance abuse. And so basically, I'm going to give you a substance and,
You just ask me if I take it.
yes, and if you do take it, just like describe like the frequency and the duration and all of that.
Okay. The only thing I take is alcohol.
Okay, so just a quart of vodka. And then you say once a day.
Mm-hmm.
And then duration, would say about a month, or
yeah. I just started drinking a quart of vodka a day, like in the past month.
okay. And then, when was the first use of the quart of vodka?
I guess it would be August 25th.
Okay. And then what was the last time you drank a quart of vodka?
I drank a quart of vodka about 4 days ago.
So the 22nd.
Yes.
All right. So no usage of caffeine or tobacco.
I drink coffee sometimes. About 1 to 2 cups a day.
Okay.
I don't drink soda.
Okay. And then what about tobacco?
No.
What about marijuana or opioids or narcotics?
No.
What about amphetamines or cocaine or hallucinogens?
No.
Anything else that I've not described from this previous list or from this current list?
No.
Okay. Okay. Is there anything current or is there anything present relating to risk factors? So risk factors could include like domestic violence, child abuse, prior health, inpatient admissions, history of multiple behavioral diagnosis or suicidal or homicidal ideation.
I guess the only maybe risk factor I'd have would be parental substance use, like during childhood.
Okay.
I was never abused as a kid. So yeah, I guess that's like. Are you talking about risk factors that occurred whenever I was younger?
I would say
or
like
just when in my life.
Like kind of like current ones.
Okay.
Like whenever you were drinking a quart of vodka, would you say that any risk factors were present, such as domestic violence, child abuse, prior behavioral health, inpatient admissions, work history of multiple behavioral diagnosis or suicidal homicidal ideations?
I did lash out at my daughter, and I hit her under the influence.
Would you say how would you describe the severity of that action?
I slapped her on the arm.
Okay. Any type of bruising or
No.
okay, so I'll just put none for these risk factors, but okay. Let me just look over all this real quick and see if there's anything else. How old would you, okay. How old would you say your husband is?
How old is he? He's the same age as me. He was born in 1988, and his birthday is February 8th.
Okay. And then Okay. Okay. So we have completed everything that was required of this psychosocial assessment. And like I said, when I first started, I don't like doing a diagnosis by the end of a first session, but it's policy. But from everything that you have described to me and everything that we have summarized within the session, I'm going to provide you the diagnosis of alcohol use disorder. And so with that, you and I can, for the next session, you and I could reiterate what you want to do, or like what you want to accomplish as we continue to work together, as well as we work on, or like I help you work on, like maybe like help you provide some resources such as AA, as well as the couples therapist that you thought would be useful for you and your husband, and maybe some rehabilitation programs if you would like that.
Okay, yeah, that sounds good.
Okay. Well, I think, like, I know that this is probably a lot, but I want you to know that it's very brave of you to take these kinds of steps, because, not everyone's willing to openly admit this type of information. So I applaud you for taking the steps and being very open and honest with me about it. And like I said from the beginning, you do have the right to confidentiality. So, what's discussed between us, it stays between us. And with this diagnosis too, now that we have an idea of what's going on, we can work together for you to be able to help yourself. How does that sound?
Thank you for recognizing that this is going to be a process, and the first step is showing up here and getting help for myself. So thank you. I'm hoping I can do it. Absolutely. I think you can too. And there's no harm in just taking baby steps with this type of situation. Yes.
So for our next session, would the same time and same place be okay with you, or?
Mm-hmm.
Okay. Well, thank you for coming in, and I'm looking forward to working with you with future sessions.
Thank you.
You're welcome.
Bye-bye.
Bye.